Welcome and good morning. I'm Jenny LeRae, Vice President for Strategy and Communications at Research America. What a day we had yesterday. It was inspiring, insightful, candid, and we have another exciting day planned for you. But before we jump into our first and very important conversation, just a few housekeeping tips and some handy features on our virtual conference site. First, please follow along on Twitter with the hashtag @RAForum. You can also chat with other meeting participants using the chat feature. Please visit the exhibit hall. There's a video vault to see all of our 23-1 videos. You can also look at the Research America booth, download our reports, our polls, and our fact sheets. And we even have a swag bag. You can save any reports or documents you like in your swag bag and then email them to yourself when the event is complete. And just a reminder, all sessions can be accessed through the auditorium. Also in the auditorium, you'll find a list of upcoming sessions at the beginning of the next day, recordings from the previous day's sessions, etc. So let's jump right into our first conversation. I am privileged to introduce Alex M. Azar, our nation's 24th Secretary of Health and Human Services, and Susan Dentzer, Senior Policy Fellow at Duke Margolis Center for Health Policy at Duke University and a Research America board member. Susan, over to you now.
Great, thank you so much, Jenny. And Alex, welcome to you. It's great to see you again, and thank you for joining us today.
Glad to be with you. Thanks for having me, Susan.
Since we're at a Research America forum, I'd like to begin by asking you about federally funded basic biomedical research. As we all know, there have been terrible effects from the pandemic, primary effects, largely in terms of the numbers of deaths and illness. But there also have been these very dramatic secondary effects, particularly in the form of idled publicly funded research and idled researchers as a consequence of the pandemic. We're in the research community, we are really grateful that you have spotlighted this issue. And as Francis Collins has acknowledged, the cost just in terms of NIH-funded research alone has been close to $10 billion. What are your views of these costs in terms of the impact on suspended research? And should there be a federal backfill of dollars to compensate?
Well, I've worked with Dr. Collins on that, and as you said, there is the issue of the labs being idled during the height of the pandemic when folks were not at work, and we're hoping that those labs are getting back up and running and research is continuing. And Dr. Collins has spoken about this publicly some. I'm going to leave. We're working with the Chief of Staff and the Secretary of the Treasurer, working on a bipartisan basis right now to see if we can get a package through Congress, but the details of that and the negotiations right now, I'm going to leave to them and not try to ventilate those right here, if you don't mind.
Understood. And of course, the research community broadly is seeking a total of $26 billion for all federally funded research affected by COVID-19. Then, of course, we have some outside groups, patient groups, and others that are looking for additional funding to support nonprofit funded research. As you said, knowing you can't comment on this, do you think in general these kinds of requests are going to be dealt with in that package?
Well, it's really hard to see what a package will entail if they're able even to get to agreement. It's been tough. This round 4.0 has been some tough negotiations. So I don't know what will end up being in there at this point. The president's very much focused on what we can do to support the economic recovery, support workers. But beyond that, I've got to leave it to Secretary Mnuchin and to the Chief of Staff as they do the actual negotiating on it right now.
Great, understood. So beyond biomedical research, let's talk about the role of other HHS agencies in developing the research basis for the pandemic response. We've noted that, among others, the Agency for Healthcare Research and Quality has been conducting some really important health services research to bring to bear questions as how telemedicine and telehealth have been utilized during the pandemic, and what do we know about the effectiveness of those strategies, especially in terms of diagnosis. What, in your view, should be the HHS-led research agenda as the nation seeks to understand more and more about what has happened during the pandemic and what kinds of efforts should be sustained afterwards?
Well, under Gopal Khanna's leadership at ARC, I think ARC is really proving to be a quite valuable part of the COVID response here. This is such an unprecedented disease, and its impact on the health system is so unique. And we're really learning. You can see that we are learning how to treat patients with COVID so much better as the time has just progressed over the last several months. And so one of the key things that ARC is doing is a funding opportunity with investigations of, as you mentioned, telemedicine, but also treatment pathways and protocols. And the idea would be to fund investigations to be able to get information out on a very short 4 to 6 month time frame, so we can get that out there, replicate that, and really enhance learnings. We saw, Susan, one of the key impacts of this with the South and the Southwest. What we saw was we went through this really with the height in March and early April in New York, New Jersey, Connecticut. And as we were convening healthcare providers, health systems, and they were learning from each other, so much of the rest of America was not terribly impacted. And then when it did hit places like Florida, Texas, Arizona, Southern California, we had to work very aggressively to essentially bring those health systems and healthcare providers on the journey that New York, New Jersey, Connecticut, and others went on a couple of months before. So this idea of learn and then replicate, disseminate information out, quite vital. There's one other initiative that we just are harnessing ARC on that I'm really excited about. As you know, our nursing homes have very much struggled with how to protect the vulnerable and how to engage in good infection control at their facilities. And we have the traditional CMS approaches of surveying, inspecting, and sanctioning through fines. But we've actually started a new approach, which is much more of a quality system by design approach using the provider relief funds. We just rolled this out at the end of last week, where we're funding nursing homes, obviously, to support their testing, their infection control, their personal protective equipment. But we've created an incentive system now for managing to keep their mortality and their infection rates below both community levels as well as below peer levels of skilled nursing facilities, and added a component where it's an issue of skill, not will, with our nursing homes. Can we get academic medical centers and others who are real experts in quality systems to help educate, mentor, bring along our nursing homes, some of whom are really just, mom and pop operators, on how to do some of the real basics of quality systems. And ARC is really helping to convene that work. I'm very excited about this and hopeful that we'll see a real improvement in our nursing home quality as a result.
Well, again, thank you for bringing those incredible capabilities of ARC to bear on this pandemic. So the federal response to the pandemic, I think, has been at best uneven. There are areas where the government has taken a very robust, extremely proactive role, spurring the public-private collaboration around development of new therapies and, very importantly, vaccines. And the support from BARDA has been invaluable to the pharma companies that are developing those vaccines, and we presume there's going to be ample payoff in terms of effective vaccines. There have been other areas where the response has not been as robust, has been mixed. We don't have any real national COVID testing strategy, for example, and there's been kind of sporadic leadership on areas like the supply chain. If we were resetting the clock on the pandemic, what do you think should have gone differently in terms of the federal response?
Well, Susan, I have to respectfully beg to differ on both of those characterizations. There is and has been a national testing strategy. It's at coronavirus.gov. You can read it. I read it regularly. It's right there. And we're following that testing strategy, and that's what's led us now to have 92 million tests that have been performed. We have capacity for 3 million tests per day. We're doing about 820,000 tests per day. We've brought rapid point-of-care antigen and antibody PCR and rapid antigen and PCR testing to point-of-care at speeds that nobody thought were even possible when we began that journey back in February February and capacities that nobody thought were possible. And we're following a strategy of ensuring that we have a system for diagnosis for individuals who are symptomatic or suspected of having COVID, getting tested, and for asymptomatic individuals for whom a doctor or public health professional believes they should be tested, get them tested and diagnosed. And then having surveillance systems that use adequate and appropriately controlled statistical sampling to determine if we're facing outbreaks in different communities. We've been working with universities and colleges and states to set up alternative surveillance systems even. You know, their schools are doing wastewater surveillance. That's a product of our research where you can actually test at a dormitory, test wastewater to determine if you have a positive case in that dorm and then surge in with testing on top of that. We've helped develop for colleges comprehensive testing strategies and surveillance systems. So I just fundamentally disagree. We have built from ground up a completely novel public-private testing system of both diagnosis and surveillance that no other country can even come close to. And then in terms of supply chain, we've taken a supply chain that really was totally not engaged in by the federal government before, and made that now something where here at the Strategic National Stockpile, we have built complete visibility into the commercial supply chain. You know, we used to have about $500 million a year of supplies in the Strategic National Stockpile. The mission of that was primarily to have countermeasures for chemical and biologic incidents and a small amount of personal protective equipment and other surge hospital capacity in the event of a regional dislocation like a hurricane, a fire, or a tornado. This is a completely different mission set now that the President's commissioned for SNS 2.0. We now have, working with our GPOs and distributors, complete visibility of the $1 trillion commercial med-surg pharma supply chain in the United States. We know where things are, we know when they're getting there, and we can use our defense production powers to actually reallocate them within that system. We have created purchase orders to onshore making of N95 respirators, making of ventilators. We're bringing pharmaceutical production back to the United States. So a more comprehensive supply chain approach than has ever been seen before. So I think those are all lessons learned from this novel pandemic, but they've also been lessons adapted to right away with historic action that I think put us not just in a better position as we deal with COVID, but as we prepare for any future pandemic.
Are you then satisfied that we have all the capabilities now in place for what is widely deemed a possibility, which is a second severe wave of COVID this fall and winter?
So, Susan, I still don't know why we speak of this second wave. That was a concept that often was talked about when there was this thesis that somehow there was seasonality of COVID, that somehow it would go into a dormancy in the summer, whether by transmission vectors or otherwise. We didn't see that, of course. We saw continued spread in the South and Southwest, and we're now seeing, of course, cases in other parts of the United States. So I don't know that this notion of a second wave remains a valid concept. Our job is to prepare for spread anywhere, as well as to ensure we've got health system capacity to deal with it, and certainly to encourage to prevent further spread through the 3 W's of wash your hands, watch your distance, and wear your face coverings if you can't watch your distance, and stay out of settings where you're just not going to be able to do any of those things. And we're in this period right now, I call it a bridge. We are so much better positioned, as I talked about just in the context of testing and supply chain, than we were 5-6 months ago. We are going to be, thanks to Operation Warp Speed, in the next several months in such a better position in terms of vaccines, therapeutics, diagnostics. We're in this bridge. And right now, the key is for all of us to engage in good personal and collective responsible behaviors of those 3 W's as we bridge to this even better place that we're going to get to.
Well, and whether we call it the second wave or wave 2.5 or 3, obviously there are lots of concerns about the coincidence of a potential major flu outbreaks alongside other viral outbreaks, possibly RSV, and all of that coming to bear at the same time as a resurgence of COVID in many areas. it's that particular set of issues that I'm really probing on here. Do you think that we have the adequate response built to respond in the case all of those things come together?
So in terms of influenza, we always take influenza very seriously, and we've actually increased our influenza vaccine production. We've got close to 200 million doses available this year. We are going to work aggressively to try to make sure that people get their flu vaccines. We're extending the vaccination period, the campaign season for flu vaccination. We want to get as many people vaccinated as possible this season. But as we look at flu incidents, and of course, nothing is a guarantee, but if you look at flu incidents in the Southern Hemisphere, we look at data from Australia, we look at data in, I believe it was South Africa and Chile, and what we've seen has been very, very anomalous low influenza-like illness activity in the Southern Hemisphere. Now, I believe in part it is because we and other countries are practicing those 3 W's of community mitigation, washing our hands, watching our distance, and wearing face coverings when we can't do that. That has the same beneficial impact with influenza. We saw, if we look back at the data back in March, we saw a precipitous bottoming out of influenza-like activity prematurely in the United States when we went into shelter-in-place methodologies. So, no guarantees. We prepare for every scenario. We have the full vaccination campaign going, but the very same mitigation efforts we're doing for COVID may have a very beneficial effect as we also look at hitting the influenza season.
And that would indeed be a silver lining of all of this. So, as you know, the 9 CEOs of 9 of the major vaccine manufacturers engaged in the work in Operation Warp Speed just issued a very strong statement that they would not seek regulatory approval for any of their vaccines before phase 3 trials are completed and safety and efficacy of those vaccines fully established. And they indicated in that regard that they were going to stand with the science. What to you does it say that these CEOs felt it was necessary to make that statement?
Well, we welcome the statement because it's exactly what the president and I and the FDA have said. We are going to move quickly on vaccines and therapeutics. We want vaccines and therapeutics as quickly as possible. We're going to use the full public-private power of the U.S. government to get there. We're de-risking these financial investments, and we can talk more about how we're doing that. But we're not cutting corners on FDA standards. This is by the book. We've been very transparent at FDA. We've put out guidance of what the FDA is looking for in terms of vaccine approval. We've made it clear there'll be a transparent advisory committee process with the FDA. So I actually welcome the statement, and I think it may help with a lot of those who are out there spreading these terrible anti-public health, anti-vax messages, because we've got to ensure public confidence in our systems and our processes. Just like our influenza season, we need to get people vaccinated. And if we do get an FDA gold standard vaccine or vaccines, we need to make sure people are willing to take them once they're available.
So I know it's hard to see outside of the pandemic at this point, but outside the pandemic, what are your priorities for HHS at this moment in time?
Well, we continue to drive on all of the things that we've been working on before, Susan. So we're working on health system transformation. We're still driving towards that transparency of pricing and quality of information in hospitals and from insurance companies. We've implemented now the health information technology interoperability platforms. We continue to work on some of the most intractable disease states like sickle cell anemia. So we still remain hopeful that within 5 years, we'll actually have a cure, a literal cure for sickle cell. I remember, gosh, it's been now probably a year and a half ago, I was up at Boston Children's and I got to see a young man who was exiting the hospital after 30 days of treatment on one of the experimental treatments with no sickles left in his blood. We want to be able to bring that promise to people. I want to drive forward on our ending the HIV epidemic so that we can continue to make progress there. We have this underlying opioid crisis still with us, and the pandemic and the social isolation have certainly harmed the progress made on that. So we've got to get back to getting people into medication-assisted treatment and ensuring people have the tools they need for long-term treatment and recovery for them. So that's just some of the things that we continue on, even as we deal with this, of course, unprecedented pandemic. The rest of our mission remains here also.
Well, Alex, we want to thank you for your service to the nation at this very difficult and challenging time, and for moving forward on all those very important priorities. And thank you on behalf of the research community for your leadership. Thanks for joining us.
Thank you, Susan. Good to be with you.
Good to be with you too.
Thank you, Secretary Azar, and thank you, Susan. An important conversation to have this morning. So before we take a brief break, let me tell you about what's coming up. First, please join us for a series of short and pithy videos from our 23-1 series. As you may know, this is a very special series featuring National Cancer Institute Director Ned Sharpless and other compelling leaders addressing a wide range of vital health issues, each of which merits far more attention than it receives. After these videos, we'll be joined by my terrific partner MC, Willie Prado, who, among the many hats he wears at the University of Miami, serves as Vice Provost for Faculty Affairs. He's also the Dean of the Graduate School and Director of the Division of Prevention Science and Community Health. He's also a Research America board member. During this break and others, please visit the Research America booth to learn more about our alliance. We're an alliance of organizations and institutes from across the research ecosystem, advocating for science, discovery, and innovation to achieve better health for all. And I want to thank our lead sponsor, Pfizer. Your longstanding support and commitment are greatly appreciated. I also want to take this opportunity to again thank our panel sponsors: Avamed, Bristol Myers Squibb, Elsevier, GlaxoSmithKline, Johnson & Johnson, Pharma, Regeneron, Sanofi, and UCB. Thank you to our fireside chat sponsors, Bio and Pecori, our advocacy and action sponsor, Eli Lilly and Company, our Flash Talks competition sponsor, ASI, and our 20 Voices, 3 Minutes, 1 Question sponsors. The American Society for Microbiology, the Association of Clinical Research Organizations, Amgen, Colgate, and the Medical Device Manufacturers Association. We'll see you back here very soon. Thank you.